So good evening to everybody, and thank you so much, Dr. Alaa, and thank you for Agora. It's my first time really to attend a session with Agora, and I'm so happy that first started with the best, as they say. So, yeah, I agree with the previous speaker that the topic is really interesting and quite tough and touching as well. So I even could feel some suffering while trying to ask, because you've really touched upon a lot of things from the theoretical point of view, philosophical, and even the first, the poster you used for the event itself is really talking a lot. Even it's very expressive. I would have really asked you also again, yeah, where are you? Are you suffering? Were you suffering during sketching such a painting, or it just used to reflect on the topic? This is my first question. And if you allow me, I have another question that is related to the pain intolerance. Do you think, as a doctor and as an artist and reader for philosophy, that person's intolerance to pain could be changed according to not only the environment, not only the, as you mentioned several things, gender, environment, genetic, extra. So, I mean, is there any other thing that has to do with the personal journey or the personal perception changing that really could affect the tolerance or intolerance that as you say in the medical field, the threshold of pain? Could it be changeable according to the awareness the person gain about himself and about his own journey?
Yeah, first for the first question, talking about the painting. Actually, when you have some thoughts and you express it into a painting or sculpture, or you start doing something and then it ends. You never know how it will end. Neither the drawing itself, nor the colors that you are going to use, nor the you start with something. This painting with other type of paintings that really I have done during the COVID-19 era, I can't say that I was suffering that much, because everyone was trying to let it go, as we say. So I can say that particularly during the performing that painting, I was suffering. But it is maybe an expression of something that came to my mind at that time. If you paint a dancer, doesn't mean that you are dancing while you are dancing, but you are painting. So it comes like that. It comes like emotional thing that happened, but doesn't really, because it takes hours. It takes days. So you are living with the subject, with the idea, and then you finish it like that. I didn't. When I started drawing on a paper, and then when I put it on the canvas, it was different. So the end result, actually, it is reflected, yes, but doesn't reflect me necessarily, because the painting is painting still. So this is for the first question. For the second, yes, I agree. The person himself or herself, her tolerance or his tolerance to the pain can change from time to time. Being vulnerable during certain period of life, it can change. For example, if you are a student in a university and you are under the stress of imagining how you will continue, what type of studies you have to go, and what type of work you might go, all these stressful things might make of you more vulnerable. But when you reach a certain degree of stability, you are less vulnerable. So the perception of painful events is totally different. For example, or we can give many examples, especially for females, actually. Being with your parents, rather being with your husband, being with kids, and everything can, many things can increase or decrease being vulnerable or not. And being vulnerable here is the point. And also, being a lady and being a man. I mean, if you are in an office and you have the same manager and he said the same thing, the perception of a female of the same thing is not the perception of the male. The male will go back with a headache, the female will go with a pelvic pain, for example, for the same event. So here comes the gender effect, the social effect. If that the same two persons came back from the office, this one has a family, had absorbed his pain, and the other one is alone, still feeling the pain in different way. So all these things, of course, yeah. So it's the play of everyone of us, and this is part of the point that I try to highlight in this presentation. It's how to receive the pain. I mean, it's the same pain, but the painful sensation that you get, it depends upon you, upon your perception. So it is real. It's not in the original sin, with my respect to all religions, but it is real. It comes with the scientific theories. That's why when you go back to the talk, I did communicated the philosophical thoughts with the religious thoughts and scientific thoughts. It's up to you to choose. So if you are happy that the pain that you have is related to the original sin, ahlan wa sahlan, good for you. If you think that you have to absorb it and you have to react and to take it as a path of deliverance, this is up to you. So it's up to you to how to deal, how is your perception of that pain. It will be reflected on the degree of the pain that you have.
Thank you, Doctor.
You're welcome.
Thank you. Now we have a question from Omar.
Yeah. So from a healing perspective, as you mentioned, Ibn Sina. So Ibn Sina mentions the healing nature of the human body. So are we able to monitor our pain to reach the healing process more faster, or can we expedite our healing process with monitoring our human healing nature? Is this a part of Ibn Sina philosophy of the human pain?
Now, I didn't get the question. So you mean that if we develop our ability to monitor the pain, we can use it as a healing process in the healing process of Ibn Sina?
Yes, and we already have a system of the healing nature of our bodies. Our bodies have a system of healing. So how can we monitor this process to expedite the healing from the pain?
Yeah, the word monitoring, I don't know what you mean by it, but what I can answer this by my understanding, the degree of pain will be much higher with those who are ignoring the source of pain. As soon as you will put your finger on the cause of pain, by that moment you start your path of healing. So part of it is recognition of the cause of pain. As long as you are roaming around and you are not finding any cause of pain, sometimes if you need help of physicians, and that's what comes as a psychosomatic pain, if you come back to that point. So if you try to find out with your physicians, different specialties, they do their job, they find no definite cause of the pain. So here it comes to the psychosomatic pain, that you are developing some sort of pain. So you have to monitor the cause of the pain. And by the psychoanalyst, sometimes I can tell you that some of my patients to whom I had to go really to surgical interventions to try to diagnose the cause of pain, because some hidden causes, we know it. I'll try not to talk about medicine too much and deep, but at the end, before going to that surgery, I'll tell them, if I don't find that particular disease that we are thinking of now, I might ask you to go to see a psychiatrist. And believe me, that some particular patients, we discovered later on that the origin of pain was a history of rape in her life when she was a child. So these things actually, if I understand well your question, monitoring, this is a type of monitoring. And sometimes you can't monitor your pain or cause of pain or degree of pain alone. You need somebody to help you.
Thank you. Thank you, Doctor.
You're welcome.
There's another question from Hada, and then Jihan.
And then me.
And then Noor. Well, I don't know if it's the same Ghada or another one, but there's... Okay, maybe it was a wrong click. So maybe Jihan, you have a question?
الو هاي. اولا اشكرك دكتور علاء، يعني رائع الموضوع والبرزنتيشن اللي قدمتها. اشكرك مره ثانيه، واشكر كل الحضور الرائع، يعني ما شاء الله كل الموجودين، واشكر نيفين طبعا على كل شيء وعلى جهودها معايا. أنا عندي سؤال يعني أو كومنت، إنه هل ممكن يعني في حيلة إحنا الأمهات كلها بتعرفها، بس هل دي فعلا يعني حقيقة علمية، يعني من ناحية طبعا رأيك كطبيب؟ الحيلة دي هي إحنا ببساطة نحاول نخفف الألم عن مثلا أولادنا أو عن خصوصا الأطفال، كان بالإلهاء، يعني بإلهاء نلهيهم بشيء تاني، فعادة أو تصرف تلقائي بمجرد ما الولد يقع أو يتخبط أو يتلسع من نار أو شيء، أبسط حاجة إنه نكلمه في شيء تاني أو نضحكه أو نخرجه من الموضوع ده بأي حركة، وكان فعلا مش بيكون متألم يعني. أو هل فعلا بيكون دي لها يعني أحب تفسر لي دي طبيا؟
of course نعم
طبعا. كبار يعني لما يكون ساعات عندنا أي ألم من أي شيء، إذا التهينا بشيء تاني ولا ندخل نرسم ولا حاجة في الاستوديو بيروح الموضوع. وطبعا يعني أحب أعلق كمان على اللوحة الجميلة المعبرة الرائعة